Hello there, my name is Mary. I'd like to welcome you back to my YouTube channel, Motivate, where I hope that everything that I share with you from my own personal experience motivates you to do things differently today, tomorrow, or better yet, right now. In today's video, I am wanting to talk to current and or future nursing students, which are basically all of you future nurses. So the piece of information that I wish I had been privy to on early on before my nursing practice is that you want to get a job in the emergency room at your earliest convenience. If you're in high school, if you're a freshman, sophomore, you may want to start out volunteering in the ER or getting a job as an aide or a nurse's aide, a CNA, and or a nurse tech in the emergency room. The sooner you get in there, the better. Volunteer, get a job, talk to somebody that knows somebody, get your foot in the door in the emergency room because this is definitely a pace in which you will learn so much and your comfort level in nursing skills will shoot through the roof. I can tell you based on my own example, I did not work in the emergency room until I had been practicing as a nurse for almost 5, 6 years. And the hospital that I started out at was one of those like just amazing hospitals. They had a dedicated IV team, and I started out on a medical surgical floor, and the IV team would start all the IVs. So for my first 5, 6 years as a nurse, believe it or not, I did not know how to start an IV. And this I learned very rapidly once my best friend at the time, who we had gone to nursing school together and she was working in the ER, convinced me to go work in the ER. And within 3, 4, 5 days, I was proficient in starting IVs, even though I had not done that in 5 years. So what I'm saying to you is the emergency room setting is the starting point of the most highest percentage of patients that are admitted in the hospital. They all almost always start out in the ER. Your strokes, your cardiac arrest, your chest pains, your congestive heart failure, gunshot wounds, suicide attempts, overdoses, respiratory failure, RSV, just about every patient that gets admitted in the hospital starts in the emergency room. A few exceptions are obviously the patients that come in scheduled surgeries, or their doctor sees them in the office and decides to admit them straight from the office to the hospital, and that's arranged differently. Some of them may or may not go through the ER. But again, a huge majority percentage of the patient that are admitted in the hospital setting are coming through the ER. Therefore, if you are a tech, CNA, aide, nurse tech, nurse intern in the emergency room, you are going to get quickly very comfortable with these patients, these diagnoses, and the best practices and best standards of care for these patients. And guess what? A lot of times you will also have a shortage of ICU nurses or beds not available in the ICU. And then you end up, oh, sorry, my hair right there is acting crazy. You end up being the primary care nurse while you're in the emergency room, while waiting for a bed to open up in the ICU. So guess what? At that point where you're taking care of that patient one-to-one and maybe one other patient, you are practicing basically like an ICU nurse. And guess what? You're learning, you're charting, your, you know, your knowledge increases at such a rapid pace than it would on a medical surgical floor or a cardiothoracic floor or any other floors in the hospital. But again, I do understand that when starting out in the emergency room can be a little bit intimidating because you end up performing codes, hypothermia protocols, um, you know, all sorts of things that are not basically performed on your standard medical surgical floors. But guess what? Do not let it intimidate you because you'll learn so fast after you first do your first two cardiac arrests, two strokes, the next one and the next one, you will be so proficient from laceration, wounds, you end up knowing which wound will need glue or sutures or even more like debridement, whatever. All those medical and nursing procedures that end up requiring in-depth medical care. You will see all of these in the emergency room. So, if you're a nursing student, please don't worry. We all start somewhere. Nobody starts in the field knowing everything. So do not let that intimidate you. You will hopefully find a caring, kind nurse or fellow technician or fellow nursing student that will be willing to show you the ropes and be there with you. And another thing you may want to do during like a code or a stroke or anything that needs continuous documentation, especially a code, volunteer to be the recorder. You will start knowing the medications, the protocols, knowing what cardiac rhythm or arrhythmia the patient is in, knowing how to treat it, because these medications are being called out loud. So if you practice recording more often than not, this will become basically like literally secondhand information like the back of your hand. And then when you're practicing that you're being the one giving patient care to that patient that comes in as a stroke or cardiac arrest, this comes back to you really, really quick. Uh, Another pro in working in the emergency room, the doctors seem very engaged with the nurses and the techs because they're constantly giving instructions, giving you verbal orders or entering orders and discussing them with you. And in the ER, you're basically just going directly to the doctor as a tech, a nurse, an aide, just asking directly, what do I need to do here? Or you ordered this, do you specifically mean this, XYZ? And it builds that rapport and comfort in not letting doctors be intimidating, especially when you are a nursing student and you feel like you don't have the enough knowledge. This gives you that confidence. And then guess what? Once you do that for a year, and as we know, a year flies by, let's say if you're a new grad and you do that for a year, you will quickly get jobs on any floor, travel assignments, because all hiring managers know ER nurses or any provider with emergency room experience has a little bit extra than you, and not that I'm knocking down any other specialty, med surg, hospice, cardiothoracic. you basically just have more exposure to different patient demographics, diagnoses, and then you're readily more prepared to deal with a wide variety than if you were just or palliative care or pediatric unit. Because again, in the emergency room, especially if it's one of those hospitals within the community that you see babies, toddlers, children, teens, adults, the elderly, you end up knowing how to treat all of these patients, and you'll end up being comfortable working in pediatrics, cardiothoracic, the stroke unit, hospice, because again, all these patients come through the ER. All right, I don't want to keep rambling on. Please let me know your thoughts on this video. If you have any questions, like I've shared before, I have been a registered nurse for a long time, a travel nurse for a long time, as well as a nursing and clinical instructor. And I absolutely love nursing, but right now I'm just taking a very much needed break, and but I'm still very knowledgeable. That's my passion, and I love taking care of people. But I also am one of those sensitive souls that it can tend to push me over the edge with my mental health. So I am learning, and I have continued to learn how to balance and know my limits and know more about myself. And that's another beautiful thing about in the ER. You learn quickly about yourself if you like that fast-paced environment, quick overturn by patients as well as staff, and you get to know about yourself a little more than you would doing the same thing over and over and over. And I have to say this because as a mental health patient myself, also as a mental health advocate and keeping it as real as possible, if you've got anxiety, ADD, bipolar, any of those flip-flop or mood up and down, or a little bit of a chaotic mind, the ER is such a nice setting. And I've met so many amazing nurses that usually have diagnoses of bipolar, OCD, ADD, and they tend to thrive in the emergency room because your brain gets to where you're comfortable with quick change. Something is not boring because one patient will be this, another patient will be this, then it'll be a baby, then it'll be a 90-year-old, then it'll be a teenager, then it'll be something completely just random, then it'll be a gunshot wound, then it'll be a cardiac arrest. And that sometimes you gotta honor where your brain and mental chemical and chemistry is, and work with yourself to kind of merge that personality with the healthcare industry, because there's room for everybody. But again, if you ever notice something is becoming too draining, too exhausting, and pushing you over the edge, take a break back and go to something else for a little while, because I guarantee you there will never be a shortage of nursing jobs, and you can try every specialty in nursing as much as you desire. All right, if you like this video, please give it a thumbs up. I appreciate you being here. Thank you so much for watching, and I'll see you in the next video. Thank you. Bye-bye.